Your book does a pretty thorough detail of comparing the anatomy of children to that of adults and the differences and how physiologically they're going to work differently and cause more acute upper airway obstructions as compared to adults. So these are kind of the major players in causing acute airway obstruction in children, or making them more susceptible to acute airway obstruction in children. And just starting at the head and working our way down, remember, babies for the first 5 months are going to be obligate nose breathers. This means that any obstruction in their nose, whether it's mucus or what have you, that is going to create an obstruction to their airway and increase their respiratory effort. They're going to have larger adenoids, tonsils, and lymphoid tissue in the pharynx. So back in their pharynx area, it's already going to be extremely crowded. Their tongue is going to be proportionally larger in comparison to the rest of their mouth as compared to adults. Their epiglottis is an omega shape, which means it's larger and less flexible than an adult epiglottis. Again, this makes it more susceptible to trauma and obstructing the airway when it becomes inflamed. The glottis is higher and more anterior than in adults. It's located at C1, whereas adults is located at C6. Again, this contributes to easier acute airway obstruction. The cricoid ring is the smallest portion of the airway in the child. The trachea in the child is smaller and more malleable. It collapses easily in response to pressure and inflammation. So as a child increases its thoracic pressure in response to respiratory distress, it's going to collapse more easily than an adult's trachea would. The lungs actually have less elastic recoil in kids, and we know this for premature infants, but this is actually true for all infants to some extent. The diaphragm does all the breathing to work. It's unable to generate higher tidal volumes, so when children and babies experience respiratory distress, they're not going to be able to take bigger breaths to overcome their ventilation needs. They're actually just going to be able to breathe faster, and that's it. And so that's part of the reason you see such extreme high respiratory rates in these age groups.